All right, everybody, welcome to tonight's information session with CVCC. If you are new to Zoom, I just want to point out that we've got a chat feature. So you'll see the chat option down at the bottom of your screen where you can post questions throughout the info session that come up. Feel free to turn on your video if you want and show your smiling faces, but don't feel pressured to do so. This session will be posted on our CVCC page, so it's recorded for you to go back to if you missed anything or share with your friends. There's also all the past information sessions that are posted on the CVCC info session page, okay? So I'll start by introducing myself. My name is Brittany Cochran. I'm one of the college navigators here at CVCC, and my job is to work with all new students. So if it's your first year or just first time in college, I will be helping you through the whole entire process through your first semester of getting everything started from applying to the financial aid and then getting enrolled in your program and enrolled in your classes. So for tonight's session, we have Mr. Joey Greer, who is the Public Safety Program Coordinator, who is going to be chatting with you all about the paramedic program and getting EMT Basic certified and your advanced EMT and just any other questions you may kind of have related to those career fields. So I will go ahead and pass it on over to Mr. Joey Greer now, okay?
Hey folks, welcome tonight. I'm just here to talk to you about the EMS programs here at Central Virginia Community College. A little bit about myself. I'm brand new to Central Virginia Community College, but it's a great program. Worked for this program over years. I've worked in Central Virginia area for 15 years as a paramedic and longer in some of the lower levels. But first off with EMS programs, we start off with our emergency medical technician. That is our first level in all of EMS programs. And it's how you really get into the pre-hospital field if you want to pursue a career in EMS. Those guys that are EMTs can handle heart attacks, strokes, diabetic emergencies, and more. They can perform CPR or cardiac pulmonary resuscitation. They can splint broken bones. They can use airway devices to ventilate patients. They can give assortment of drugs that can help with a allergic reaction or a narcotic overdose from medications. And they do all this with about 120 hours of training. That's 120 hours of classroom and hospital time, medic unit time training that they receive. And then after they're done that, they can sit for the National Register of EMTs cognitive exam, the written exam, and pass that, and then they will be nationally certified and state certified in Virginia to be an EMT. That allows many different opportunities. They can go work for a 911 agency. They can go work at the hospital. They can work for an industrial place, places like Glad Manufacturing, and a lot of the paper mills in this area will hire EMTs to work and be on site during the workday. We have several different classes that start. We have a summer class that's actually starting in May, at the end of May. If daytime and nighttime summer class, it's 4 hours, 3 days a week, and for 10 weeks. And it goes from May to the end of July. And at the end of July, you'll be able to test for your EMT. And then we also have a fall class that starts, nighttime and daytime fall class that starts, and that starts the third week of August, I believe.
Yes, yeah, you're right. Towards the end of August there.
And all those great opportunities. If you're already EMT, we can go to the next level, which is advanced EMT. We have advanced EMT has about 150 hours of additional training on top of EMT. So they can do all the same interventions and same medications that EMT can do. And additionally, they get to start IVs. This is a huge step in the pre-hospital field, getting that IV medication drip available for the hospital, or also giving any needed fluids that the patient may need. The advanced EMT, it starts in the fall and continues into the spring semester. And we sometimes, and probably will, run one in workforce, still working the details out for that, but work in workforce advanced EMT for the fall as well. And to kind of explain the difference, you have a credit side, which allows you to get a degree through Central Virginia Community College as a paramedic, and that's the last level that we'll have to talk about. Or we have the workforce side that allows a little bit more adaptive. It's more meant for the working person. It's normally at nighttime classes and allows for you to take classes at night and still get credit for your EMT or advanced EMT. Either way, if you take the workforce or credit class, you still sit for the same exam and you're still certified at the same level. So you're still certified as EMT or advanced EMT, whether it's workforce or credit class. It's just if you want that college credit or not. That's the biggest decision you have to make. Do you plan on using that college credit later on, or do you plan on just going into the field and working? And that's the reason why we call it workforce, because it's all about getting out there and getting employed. But advanced EMT, like I said, has additional 150 hours. Those additional hours can be in the hospital as well in some classroom. And they have additional training that they are allowed to do, more medications that can help, from pain medications to any IV medication that does not deal with cardiac drugs, so heart drugs. And then our last level is paramedic, and this is our degree program here at Central Virginia Community College. It has about 67 credits if you complete the whole thing, starting from CPR, your first day of class, all the way to the end, taking your paramedic. You have some general educations in that you have to take, such as English. You also have a bio class. Bio 145 is recommended, but you can take bio 141 and 142 if you choose to do so. Both of those are just a little bit more detailed into the anatomy and physiology of the body. You also have, as far as general education, I believe you also have a college success, which any student coming into CVCC takes a college success, just to make you prepare for college, and also get used to the programs and things that we use at CVCC. So you're not going into this blindly. And then you, I think I said English already, and I think that's it for population. Sorry, yes, you have a Psych 205 dealing with conflict and crisis management and interpersonal communication, CST 126. So that's pretty much your general educations, and the rest of it is all EMS classes. You cap it off. You have general electives as well, if you do not take that 141 and 142 separate. And then you have all your EMS classes that go from, you'll learn cardiology, where you will learn how to read electrical rhythms of the heart and how the heart is beating correctly. You learn a medical patient and trauma patient. As far as trauma patient goes, those that are involved in accidents, explosions, gun wounds, stabs, etc. Any of those horrific things that we think about, you'll learn in that trauma class. And then your medical class, you deal with the patient that's had a stroke, a seizure, a diabetic call, heart issues, any type of heart issues. And you also go into one of your last ones is EMS operations. So learning how EMS works all together, such as working with different agencies such as fire departments, police departments, your search and rescue teams, you'll learn in that operations class. You have many times EVOC classes, emergency vehicle operation class. So learning how to operate an emergency vehicle. And that's pretty much sums it up. Going back to workforce and accreditation, just some popular things for workforce is you pay whatever workforce, whatever grants or whatever you don't get and money from grants or whatnot, it covers everything for the program. So there is some hidden costs in the program, I guess you would say, such as we do require you to buy a polo for your clinical shirt. So because you have to be recognized as a student when you're on these clinics, because patients do have the options not to have students work on them, but most of them don't. I've rarely have seen that. So most patients agree to help the students out. And then we have, I think that's pretty much all then you have test fees. Sorry, you have test fees at the end of the year. So you'll have your national registry test fees, which is about $110. And then for the written test, and then the practical test, you'll have about between $75 and $80, depending on what you need when you get to that point. So those are the hidden fees, and those are kind of the items about paramedic. Workforce will cover all that. Credit side, you have to pay for it, but like I said, you get that college credit that mostly transfers. A lot of them transfer to different 4-year degrees. All right, so is there any questions?
All right, let's see. I'm looking at the chat. I don't see any questions in chat just yet. I know we've got Jeremiah out there. If you have any questions, please feel free to unmute yourself and ask any questions. Let's see. I know I have a question that some students will ask. So do you happen to know in regards to clinicals, when they're ready to do their clinical rotations, how is that worked out? Is that something you help them find clinicals, or they go out on their own to find placement for a clinical? Or, you know, how many hours is it like ride along versus at a hospital? Do you know?
That's a excellent question. And I should have covered it, sorry. But
No.
yeah, clinicals, we set up clinical sites at different places, such as Central Emergency Room, labor and delivery at Virginia Baptist, the psychiatric at Virginia Baptist, with Lynchburg Fire Department, Amherst County Public Safety, Beaufort County Public Safety, and Campbell County Public Safety. We set up, and it may be others, I hope I didn't forget any, but we set up your clinical time with them. You do go by yourself, which if anyone's familiar with the nursing field, nurses normally go in groups. But as a paramedic, you kind of go by yourself. You're one-on-one with another nurse or another paramedic, depending on where you're at. And as far as hours go, clinical hours, there is a minimum of clinical hours, but it's more about competencies, what items that you see while you're at the clinical site. It's so birthing a live baby is a clinical competency. That's one we can simulate, because sometimes our students population doesn't actually get to birth a baby, because that's all about timing.
Right.
And but that's one we can simulate, but you may have to spend several hours at labor and delivery to even get some of those assessment skills that you need for your obstetrics. Okay. Or you spend a lot of time in the emergency room, because that's where most we can get almost anything that we need there. As far as IV sticks, you have to get so many IV sticks to finish clinicals. You have to get so many medication administration to finish clinicals. So there is a minimum hour, but most of our students go far beyond that minimum hour to meet the competencies that they have to get.
Okay. Great. All right, let's see. No questions in the chat yet. All right. Well, thank you so much for sharing some insight on the paramedic program and advanced EMT and then EMT basic. I will go ahead and share some important upcoming dates that we've got. So right now, summer enrollment is open, like Mr. Greer mentioned. So summer enrollment's open. Classes start May 23rd, Monday, May 23rd on the credit side. And then our fall enrollment is going to begin on April 4th. So April 4th is an important day to note. If you're looking to enroll in fall classes, those classes would begin in August, like he mentioned, towards the end of August. So we can start making your schedule with you starting on April 4th. So I will post in the chat the contact information, but the best way to go ahead and get started is to reach out to the counseling office. So the counseling office is where you will meet with your college navigator, and we will help you with the getting started process to then connect you with, someone like Mr. Greer or somebody else in the paramedic program, if that is the program that you are interested in going into. And then they will kind of help walk you through the different classes that you'll need to take, especially if you are coming in with some certs already complete. So you may have already completed your EMT basics somewhere else. So then we just need to get a copy of your certification so that we can award credit for that. So April 4th, important date for your fall enrollment. These sessions are every Tuesday. So you can go to our CVCC page and review past sessions of different programs, or share this one with your friends that might be interested in the paramedic program or getting EMT basic certified. Also, I'll go ahead and throw out another important upcoming date, April 12th, because it's kind of right around the corner. April 12th is going to be a machine tool open house. So if you happen to be interested in machining, we've got an open house on April 12th here on campus going on specifically for that program. All right, so any questions does anybody have about paramedic or just getting started, financial aid, any other questions on your mind right now? We'll take a minute here. And if there's no questions, we'll go ahead and wrap up this info session just a little bit earlier here. All right, so Jeremiah, I don't see anything from you or anybody else. So we will go ahead and wrap it up. Thank you so much for joining us tonight. And we are looking forward to seeing you guys on campus in the summer or fall. And we will be happy to help you get started here at CVCC. Have a good night. Bye.
Bye, Brittany.